Hospitals across Northeast Ohio are still conserving IV fluids after Hurricane Helene led to a major shortage just 2 months ago, more than 2 months ago now.
Baxter International in North Carolina, which produced up to 60% of the IV fluids used in hospitals nationwide, was forced to stop operations after it was flooded by the storm. Now, while some production has resumed, still a shortage.
Yeah, so News 5's Dina Busada spoke with local hospitals about how they are continuing to provide necessary care despite the lack of critical products.
IV fluids can be used for a list of things. Hydration.
People tend to feel better when they're well hydrated.
Medication.
They're used to mix medication.
And of course, surgery.
IV fluids are being used for that rinse cycle, if you will, for different abdominal surgeries, pelvic surgeries, etc.
But now hospitals across the nation are having to reel back their IV usage due to a major shortage.
So this was really surprising. This was not something that we saw coming.
The shortage began in September, not long after the Baxter International facility in North Carolina was forced to halt production due to damages caused by Hurricane Helene.
So almost immediately we realized, okay, we're going to have to take some drastic measures in order to, survive this crisis.
In response, many hospitals quickly formed emergency teams to develop strategies to conserve IV fluid usage. At Metro Health, Dr. Christine Alexander-Rager says they've seen fluctuations in availability of different IV fluids. At one point, they had only 7 days worth of normal saline and 3 days worth of another IV fluid. To conserve, the hospital's been using oral medications and hydrating fluids when possible.
With looking at when you have a procedure done, what is the minimum amount of fluid that you need for that procedure.
We also reached out to patients on News 5 social media, asking how the shortage has impacted them. One viewer wrote that during her chemotherapy treatment, she was given oral medication instead of an IV drip. Another viewer said she can't get an infusion for her critical illness unless she goes to the ER or waits until next year.
But for right now, we think we're in reasonably good shape. We're little by little getting more.
In the process, Metro Health says they have not had to delay any surgeries. In statements to News 5, both the Cleveland Clinic and University hospitals have confirmed they have also been impacted by the shortage and have also developed strategies to conserve fluids without having to delay surgeries.
We are going to be able to take care of you. We're taking care of the conservation of these fluids on our end, but is not something that you should be worried about.
Dr. Alexander-Rager says they now have up to 21 days worth of IV supplies, and they hope that number keeps increasing. Reporting in Cleveland, Dina Busada, News 5.
The Baxter plant did partially reopen in October, but the American Hospital Association expects the shortage to last through March.
My goodness. Okay, we talk weather now. Here's Mark. Thanks for the beautiful night outside.
Yeah, what a great night.